começando mais um Jornal de Quinta.
Bom, hoje nós traremos um assunto muito interessante para o mundo feminino, né? A tão famosa gordurinha, cientificamente conhecido como tecido adiposo. E hoje quem vai estar lá entrevistando o biólogo Guilherme vai ser o nosso querido repórter Animal. É com você, Animal!
Para Animal!
A gente está aqui com o nosso biólogo Guilherme, diretamente para o Jornal de Quinta. Ele vai nos responder algumas perguntas sobre o tecido adiposo. Guilherme, o que é tecido adiposo?
Tecido adiposo é uma especialização do tecido conjuntivo. Ele é caracterizado pela presença de adipócitos.
E o que são adipócitos?
Adipócitos são células que armazenam gorduras.
E qual é a função do tecido adiposo?
O tecido adiposo tem a função de servir como reserva energética para o corpo atuar como isolante térmico.
E o que determina a quantidade de tecido adiposo presente em um indivíduo?
Determinado pelos fatores genéticos e pela ingestão de calorias.
E essa foi a nossa entrevista sobre o tecido adiposo aí, o tecido das gordurinhas. Então agora, muito obrigado aí, biólogo Guilherme. Com o pessoal do estúdio aí.
A eliminação do excesso de tecido adiposo é por meio de uma cirurgia chamada lipoaspiração. Fique agora com o processo de eliminação do tecido adiposo, mais conhecido como tecido das gordurinhas.
Hi, this is Dr. Art Foley, and I wanted to thank you for watching our abdominal liposuction video. This video was done in the office where we do the majority of our operative procedures. This shows the patient before surgery. You can see she has a paniculus, or a little bit of a spare tire, with the widening on the hip roll there laterally. Typically what I do is I mark the patients out standing before they've had any kind of medication so that they can see the areas we're going to do the fat suction on. You can see she's a little wide in the hips there, and we're going to reduce that, in addition to reducing the entire abdominal area. This way the patient has a good idea where we're going to make the little puncture wounds. In this case we had 2 little puncture wounds to do the entire procedure, and she knows where the liposuction will be performed. We do these procedures almost on a daily basis in the office and under general anesthetic. This shows the tumescent technique, which is the technique of injecting. We make a small puncture wound in the skin, and then we actually inject a local anesthetic. The local anesthetic does a couple things. One, it gives the patient more comfort after surgery, and here I am just injecting the local anesthetic. The other thing it does, it has some epinephrine in it, and it causes the patient to have a lot less bruising or bleeding with the operative procedure. Now I'm just going through the fatty tissue and injecting that numbing medicine. And we find it's very helpful to break up the fat and ease in liposuction, or ease in the removal of fat. You can see in the canister where the fat's being sucked out and from the patient's abdominal area and then goes through the tubing in the canister. There's not much in the way of bleeding. There's the fat coming through the tubing. And you can see as we keep working there'll be more and more fat removed. There's already half a liter of fat that's removed. And this is all done very carefully between the skin and the muscle in the fatty layer of the abdominal wall. And you can see as I'm working, the skin is actually becoming more thin, and we're getting a lot more fatty tissue out. You can see how now the skin is much thinner on the patient's right side and still pretty thick on the left side. It's somewhat like a deflated balloon. The skin envelope actually will retract with time, especially if the patient doesn't have really bad stretch marks and is relatively young. The skin tends to redrape quite nicely. This is a very small cannula that we're using to remove the fat. It's blunt on the end, and it has multiple holes. It's very safe, and it's very effective. I use my left hand to feel where I'm going, and the right hand guides the instrument. As we've worked more and more, you see on this patient, the skin is becoming thinner. I'm working on the flank on this particular portion. Now you can see how much thinner things are becoming. I can lift up the skin. In this particular patient and most patients, there's a very little bleeding actually with this, and hopefully there won't be much bruising after surgery. Bruising varies from individual to individual. Now you can see the abdomen is much flatter and the skin is quite thin. I'm just going around doing a pinch test, and here's the fat removed, and that's probably near 3 liters of fat removed. I put a little stitch underneath the skin just to hold that little puncture wound together, but there's no actual stitches that have to come out. These little tiny stitches dissolve in about 4 to 6 weeks. And I put a little tape to protect this. Usually people can shower within a couple days following the procedure. Thanks a lot for watching this. I hope this was informative.
Bom, chegamos ao fim de mais uma reportagem de Renan.
E se você quiser ficar sabendo mais sobre o tecido adiposo, entre no nosso site. Boa noite.
Cala a boca, Renan!
Animal!